All right, so we are live. Hi, Lenny.
How's it going, Leah?
Good. Let's introduce ourselves first. I'm Leah Todd. I'm based up in Lebanon, New Hampshire for the Solutions Journalism Network. And I am delighted to be here virtually with Lenny Bernstein, a reporter for the Washington Post who's covering health and medicine. In 2017, just a bit about your background, Lenny. Lenny won the George Polk Award for medical reporting for his work connecting lax regulations on narcotic painkillers to pressure coming from the pharmaceutical industry and their allies in Congress and the Justice Department. Today, we're going to talk with Lenny about a different kind of story that he told recently in the midst of this coronavirus pandemic. And Lenny, I am so happy to be talking with you. Thank you for making the time.
It's totally my pleasure. Thanks for having me.
So we are talking today, each from our respective homes, during this era of social distancing in COVID-19. And we're focusing on one of your stories that takes a close look at what one state may have gotten right early on in this whole pandemic. So the story was dated April 9th, which was a couple of weeks ago now, with the headline, "Did Ohio Get It Right? Early Intervention, Preparation for Pandemic May Pay Off." So Lenny, you started this story with the scene of a Republican governor making the controversial decision to shut down a major fitness expo in Columbus, Ohio, before there was even a single documented case of coronavirus in the state. So you walk through how the medical community responded in Ohio. A couple of CEOs of some major hospitals, for instance, in different cities, met and decided to collaborate instead of compete on just about everything, you said. And you chart the results that the state has been seeing so far. So Ohio at the time had a fraction of the cases and deaths reported as compared to other similarly sized states, even states that had tested at about the same rate as Ohio. So I have to say that this story caught my eye. It was in the headline in one of the Washington Post newsletters on April 10th. And I don't know about you, but I do not open every newsletter that comes into my email inbox, but I opened this one. So I wanted to take a deep dive with you to understand more about how you and your editors thought about this story and how the story developed, and then importantly, what's happened since. So I want to start back at the beginning and start by asking where the story idea came from and how it developed for you as a reporter over time.
Sure. It actually started at the tail end of what ended up being in the paper and on the site. I cover medicine, and so as a result, I'm constantly trying to get inside hospitals and medical institutions during the era of COVID-19, because obviously there's so much going on that our readers don't know about. And in talking to the Cleveland Clinic, which is one of the elite medical institutions in the United States, it became clear to me that they appeared to be pretty well prepared for their surge. Now, at that time, a month ago, which seems like 100 years ago, no one knew exactly what the surge was going to look like. So Cleveland Clinic and the two other major medical institutions there, Ohio State and University of Cincinnati, they adopted a prepare for the worst, hope for the best kind of situation. And their leadership got together and they said, they divvied the state into 3 regions, which they were used to begin with. And they said, okay, we've got to prepare together. We've got to prepare for a tsunami of cases coming our way. Mm-hmm. So that's where I entered the story. And actually, Mike DeWine, the Republican governor you mentioned, was one of the last people I interviewed as, I became aware of the Arnold Fitness Clinic and what he had done there, and then subsequently what he had done to close schools early, even as you mentioned, when there was not a single case in Ohio. So that's how I got into the story. But what you quickly realized when you looked at the numbers, before I did any work, I had to look at the numbers, right? Because if Ohio didn't have a better situation in the states around it, you've got no story. Right. What you realize quickly is that this was a triumph of leadership. It was a triumph of leaders who took the time to understand what was going on and to look down the road and to confidently move in the face of skepticism. That's what DeWine did. That's what these heads of these hospitals did. And when leaders do that, I feel like we should give them their due if we can. Now, predictive stories, as any journalist will tell you, are the worst because the minute things change and you're wrong, the trolls are all over you. I've had that experience during COVID-19 with a different story. So you're always worried about that, and you always have to include a number of caveats.
Right. And I want to get to the caveats here, but let me ask you a quick question about this chronological process as the story developed. Was there a point in time when you and your editors decided that there was enough evidence on the ground in Ohio to move forward with the story? And if so, what did that conversation look like?
Fairly shortly. I said to my boss, I've interviewed the Cleveland Clinic. Here's what they're doing. It makes a lot of sense to me. It's a huge number of beds. I think they plan for a capacity of like 8,000 beds. Mm-hmm. Beds in hotels, beds in the medical school, beds in a stadium, beds everywhere. And then, getting ventilators and PPE and all those things that we're all familiar with now. So I felt that was good. Then when I looked at the numbers and I saw that, they had a third of the cases with similar testing regime, I felt like that was pretty good. And then I talked to the other two medical regions, and I felt like, yeah, these people get it too. Mm-hmm. So that's when I proposed the story.
Great. And walk us through how you reported this story. We've been getting a lot of questions from folks who work in local newsrooms in a community and are all very accustomed to meeting people in person, observing things playing out on the ground, and so are less familiar with reporting from their house, which is presumably what you did for this story. So what did that look like?
So the Cleveland Clinic knows me because I've been covering this beat for a number of years, and so they were fairly cooperative. They made their CEO available to me, and we talked for a good 45 minutes. And then they referred me, and then I also talked to some of the medical people on the phone, and then they referred me to their counterparts at the other two institutions. So I didn't have to dig them up. And even though I was a stranger, as every reporter will tell you, if you come with a referral from somebody they know, they're much more comfortable right to begin with.
Yep, that's a great point.
Yeah, so I just did it on the phone. I mean, I couldn't go see the beds, even though they were there. I couldn't go to the Columbus Convention Center and make sure that, the vents were all hooked up and that it wasn't a disaster there. So you're not as comfortable believing that when you can't see it with your own eyes, but what choice do we have at this point?
And did you take any other additional steps, call any additional sources or talk to other folks who maybe didn't end up being quoted in the story to give you that level of confidence that you've verified the information that you were getting from afar? Since you
just one or two, but there was enough coverage in the local media that, I was comfortable with it, with caveats, with being very transparent with the readers that, there's no dateline on this story. I'm not there. I find these people credible. Mm-hmm. They're a long-standing elite medical institution. If they are flat out lying to me, it's going to reverberate on them one day. Mm-hmm. So, and I had a level of credibility with people I had talked to over and over and over again over the past few years. So I knew what they were like, and I believed in them. Also, they sent me some of their internal planning material.
Great.
So I could look at those numbers that way.
So it sounds to me like you were using sources who you had relied on before. You triangulated using local sources of news. So other journalists and news organizations on the ground to look at their coverage, and then also documentation from the internal planning.
Yeah.
Great. So let's talk about evidence, because I know this is an important part of the conversation as you think about, responsibly sharing these numbers, promising early outcomes in Ohio that we know have changed a bit since this story ran. So we are hearing this question a lot from journalists in our network who are trying their best to put these rapidly changing numbers into context. And I want to point out a couple of things that you did in this story that I think are really smart, that help readers understand how to make sense of this data and Ohio's early results. So one thing that you said that was just a phrase that jumped out that I think others could learn from is you say, with the pandemic still spreading, it's too early for certainty on whether Ohio's actions have spared it the worst of the virus's impact. You also say there's no way to account for luck, good or bad, which I think is probably a phrase that should be in every story that publishes around COVID-19. And then on top of that, when you compare outcomes across a couple of different states, which you do in this story, you actually put all three of these data points together in the same sentence. You report the number of cases, the number of deaths, and the number of tests statewide all at once. So I admired that about how you reported these numbers in the story, but I would love to hear you talk a little bit about how you thought about your responsibility as a journalist to paint a picture of the evidence on the ground without overpromising and without predicting the future.
So let's first look at the fact that the pandemic is still raging. This is an ongoing, changing story. Tomorrow's going to be different from today. The next day is going to be different from the day from tomorrow. So what are you going to do about that? You can't do anything about that. You just level with people. People are smart. They understand that. The subject of luck is unfortunately really important in this pandemic, because wherever that somebody came in and seeded a local outbreak, particularly early in the pandemic, has a lot to do with how the larger society in that area is going to do. So unfortunately, somebody got into that nursing home in Kirkland, Washington. It's not where you would expect the pandemic to blossom first, right? You're thinking New York, you're thinking LA, you're thinking San Francisco, maybe Chicago, where people are traveling from China. No, Kirkland, Washington. Why? Bad luck. It's just bad luck. Somebody with the virus ended up there. And again, you level with people. Then the other thing I had to do was, everybody I spoke to said, now look, it's not going to be smooth from here on in. We're going to have bumps. And instead of, I'm going to use my hand here, instead of a smooth slope downward, we're going to go like this. It's going to be a sawtooth. And they said the sawtooth is, the bumps are going to come from prisons, nursing homes, juvenile institutions, places where people are unfortunately packed together closely. Well, it's exactly what we've seen. About 2 weeks after the story, or a week and a half after the story, there's a huge outbreak in a prison in Ohio. And that changes the situation on the ground, but you can only do what you can do at that moment in time.
That's a great point. I'm sort of thinking as you're talking here, Lenny, that, when you're thinking about predicting where these outbreaks are going to happen, just find places in the Midwest that look like Brooklyn in terms of their population density, right? That the prisons and nursing homes and hospitals are the places where that level of density is mirrored as what we're seeing in other more urban places around the country.
Right. I mean, density is important, but also, that spark that sets off the wildfire.
Right. So there are a lot of really good insights in this story, Lenny. You have a paragraph late in the story that really concisely sums up what other states or other people reading this story might take away or might learn from what Ohio has done. You talk about how Ohio identified this as a priority and an issue early. You describe, as you said earlier, the plan for the worst, hope for the best mentality that kind of governed how Ohio responded. And you also say, assume the virus is spreading, even if you're not testing. So I wonder, and I'm curious from your point of view, why this story deserves a spot in the world right now. Why was this an important story to tell? And what takeaways do you hope that readers come away with after reading this story?
So this story does what we're all looking for as reporters. This story zigged when everybody else was zagging. Things were bad in Michigan. They were bad in Illinois. They were bad in Pennsylvania. And they were slightly better by, 65% in Ohio. And you can look at the numbers on COVID tracker and see how many tests are being done and see how many people are dying and see how many cases there are. And, here's this Midwestern state that stands out. It just stands out. You can't miss it when you look at the data. It's very quick and it's very easy. So that deserves its place in the journalism universe, in this tsunami of coverage that we're all doing that's terrific and pointing out all the problems. But there was this little bright spot. It deserved to be highlighted. And then You had the additional development, the fact that it was a Republican governor doing something different from a Republican president, taking, the opposite view, taking an opposite tack. And I can't tell you how many emails I got that said I took a, undeserved gratuitous shot at the president. But that's not really what I was trying to say. What I was trying to say was, this thing doesn't care about party. It's a virus. And Mike DeWine took up a leadership role on this. He's a Republican. I don't care if he was a Democrat or Republican, an independent or, non-aligned. He took a leadership role. He listened to the scientists, and he was very, he took a risk. He started shutting down his state when there were no cases because he knew what was really going on, and he took a lot of heat for that.
And that sounds like this moves the story that originally came from the data, just looking at the numbers, translates it into more of a political story also, right? That's interesting. So what's happened since? Either impact, feedback that you're hearing from, coworkers or from readers on this story. And we also talked a little bit earlier about the spike that has happened in prisons, just like you included in the story a couple weeks ago.
The story got a tremendous response. I think people were hungry for something that showed them how to do it right, because 99% of our coverage is what are the states or the federal government or somebody else doing wrong. So I think they were hungry for that. There was a lot of partisan blowback in my email and on Twitter. That's fine. That goes with the territory. But I do think people were hungry for this. Subsequently, I've seen other stories in which people have said, North Carolina is doing a pretty good job. Minnesota is doing a pretty good job. I actually thought originally about doing this story in Minnesota, but outside of Minneapolis, St. Paul, it's a very rural state, which makes it somewhat easier to accomplish what they've accomplished. Not totally, but a lot. Whereas Ohio has those 3 population centers.
That's a great point.
What has happened subsequently, as not I predicted, but the scientists predicted, huge outbreaks in prisons, big outbreaks in nursing homes and other rehab facilities, juvenile centers. They have upped Ohio's numbers, but I was just looking at this yesterday and preparing for this interview. It's still proportionally to Illinois, Pennsylvania, and Michigan, still about 40%.
Wow.
So they haven't caught up, and they also have been lucky in that they haven't gotten that spark that sets off the wildfire.
Yeah.
So you could argue, and I'm sure they would, that that's because they're on their toes. Maybe that's true. If true, more power to them. If they're just lucky, fabulous.
Right. I like how you described that there was an audience who was hungry for information like this. And I think that really describes my reaction as a news consumer. I was hungry for a headline like this. It just immediately, asked me to go deeper into the story. And I sat with the story, wanted to really understand what was going on in this state, and not just because it's my home state where I grew up in Ohio.
Right.
So Lenny, let me ask if there's...
I just wanted to say,
yeah.
A lot of care went into that headline because we knew we could not write Ohio got it right. Because that's like inviting the gods to come in the next day and prove you wrong. So, the farthest we were willing to go, me and my editor were willing to go was, did Ohio get it right?
With a question mark.
At that question mark. And at that moment in time, April 9th, they were doing a pretty good job.
That's a great point. Well, Lenny, anything that I have not asked that you think is important to mention or add here?
I think local journalists who have been trained to be critical and to point out flaws and to be skeptical, all the wonderful things that we do, should just keep an ear open for positive stories. You're not going to do them very often, but you're going to stumble on them, or you're going to find them through your terrific research. And just, like we always talk about in the office when we can be in the office is, what can we do that zigs when everybody else is zagging? And those stories are well read, and they generate traffic. And as long as they're well vetted, do them.
I couldn't agree more. We often talk about positive deviance when you're looking at a data set. In addition to looking at the worst performers, the worst behaviors, also look at who's bucking a trend in unexpected ways. So we talk a lot about positive deviance in the data, which I think is exactly what you did here in this story. So Lenny, I can't thank you enough.
Oh, it was my pleasure. Absolutely.
And have a great weekend and wash your hands.
I will many times.
Thank you.
All right. Bye-bye.